Difference between palliative sedation and MAID. Palliative sedation and medical assistance in dying, MAID, are two distinct approaches to end-of-life care, but they have different aims and purposes. Here are the differences between the two. Purpose. The primary purpose of palliative sedation, also known as terminal sedation, is to relieve severe suffering and provide comfort when all other measures have been exhausted. The goal is to ease distressing symptoms, such as pain or breathlessness, by inducing a state of decreased consciousness. The primary purpose of MAID is to intentionally and deliberately hasten the death of a person who meets the legal and eligibility criteria, such as having a grievous and incurable medical condition that causes intolerable suffering. The aim is to provide a choice for individuals to end their life with assistance from a legally approved medical team. Decision-making and involvement. The decision for palliative sedation is typically made collaboratively between the patient, their family, and the healthcare team. It is considered an appropriate option when the patient's suffering cannot be adequately controlled through other means. The decision for MAID rests solely with the patient, who must meet strict legal criteria and request their own death. The involvement of healthcare professionals is required to assess eligibility, provide information, and perform the medical procedures. Medical professionals can choose to be involved or not. Timing. Palliative sedation is usually considered when the patient's symptoms cannot be adequately managed using other palliative care interventions. It is an option in the terminal phase of an illness. MAID is an option that can be pursued at any stage of a grievous and incurable illness, provided the legal criteria are met. It is not limited to the terminal phase of a disease. It is important to note that the specific laws and regulations regarding these practices vary between jurisdictions.